Aloha and welcome. I'm Dr. Catherine Taketa-Wong, and I'm glad to be with you for today's Facebook Live event. Ever since the COVID pandemic, we've been hoping that dealing with viruses would end. That expectation is understandable, but unfortunately represents misplaced optimism. What's vital for our own well-being and for our families and our communities is to come to terms with what's happening with viral diseases, like the latest one, which is monkeypox. And it would be great if we could just go back to how things were. And someday, hopefully sooner than later, we might, thanks to the hard, complex, and often thankless work of our scientific and medical communities. But in the meantime, our best way forward is to get educated about the various viral threats and take action to prevent them from spreading. Today, we're going to do exactly that by focusing on monkeypox, so please take advantage of this time together. As a naturopathic doctor and licensed acupuncturist, I regularly remind my patients that the idea that we are just a sum of parts, that we're made up of parts, is misguided. Remember that the body is a single organism, so everything is connected to and affects everything else. A strong immune system is what fights off viruses and other pathogens, and we don't get a vibrant immune system without a whole body approach to health. Therefore, because every aspect of our body is connected, getting the nutrients we need is the foundation of a healthy life. Yet in the United States, fewer than 20% of conventional medical schools require any courses in nutrition. Of those 20%, the typical offerings total fewer than 25 hours. That's 25 hours of training in 4 years, at a time when most of our chronic diseases are food-related. Naturopathic doctors like myself typically receive 155 hours of nutrition. We are trained to educate and guide patients to build their physical and emotional health from the inside. So while I attended a 4-year medical school, just like MDs, and order lab tests, write prescriptions and such, I approach treatment comprehensively, including all aspects of a person's health, which is why our patient visits are 1 hour, not 10 or 15 minutes. It's a partnership for health between us and our patients. Now, if you have a health condition that you would like to talk with me about, please contact our office and schedule a free phone consultation. There's no charge because I don't take new patients without reviewing their situation first and coming up with a plan to help you get better. All of the contact information is on our Facebook page. Now, let's begin with talking about the viral issues and many of these concerns by talking and explaining 3 terms that are used for transmissible diseases like monkeypox. The 3 terms you often hear used are outbreak, epidemic, and pandemic. Now, what is the difference between all of these 3? Many people are confused about what they actually mean, and they kind of will use them interchangeably without really understanding what they actually mean. Now, an outbreak is when there is a greater than anticipated number of disease cases that occur within a certain geographic location. It's not the total number, but it's the amount anticipated. So in some situations, if there are no cases of a particular disease that are anticipated, just one single case can be an outbreak because it's a higher number than the number anticipated. Now, if an outbreak is not controlled, then it can surge into an epidemic. An epidemic is a disease that affects a large number of people within a community, population, or a region. COVID-19 started with an outbreak in China, followed by an epidemic in certain regions, followed by a pandemic that affected the whole world to one degree or another. So a pandemic is an epidemic that has spread over multiple countries or continents. Monkeypox has been declared a public health emergency by the World Health Organization, which is trying to prevent it from becoming an epidemic or a pandemic. Now, just days ago, the president declared monkeypox to be a health emergency in the United States, which helps to free up resources and provides additional abilities to federal health agencies to collect data and spur the manufacture of vaccines and medications. Currently, tecovirimat, a smallpox drug, has not been approved for use with monkeypox, but it may be approved for emergency usage, which is similar to some of the medications approved for COVID-19 and its variants. Now let's go through monkeypox, and learning the basics about monkeypox are very important in terms of helping this to prevent it from becoming a more severe epidemic or preventing it from becoming a pandemic. Now, what are the signs and symptoms? A few of the early signs and symptoms include fever, headache, muscle aches, cough, and congestion, which may be difficult to differentiate from other diseases. However, it is then followed by a painful and or an itchy rash that may include blisters. And sometimes a rash may present itself first, but it's not as common. Now you can go online and look up pictures of monkeypox to be able to see the pictures, because there are very characteristic types of lesions with monkeypox, so that can be helpful. Now, how is monkeypox transmitted? The CDC, or Centers for Disease Control, says that it can be spread to anyone through close, personal, and often skin-to-skin contact, as well as through objects and materials. So think drinking cups, utensils, clothing, bedding, etc. It's also transmissible from infected animals or from preparing or eating their meat. The disease originated in animals and was transmitted to humans. Now, I need to be very frank with you about one aspect of this virus. In humans, it was initially concentrated in men who had sexual contact with other men. However, this is not, I repeat, not a sexual disease limited to gay men. Men can give it to women and vice versa. Children can give it to each other. A person may touch the sheets or towels of someone who is infected. Now, this is extremely important to understand, because if not, people may think they can't get it, and then they may become complacent about protection for themselves, their family, and the community. What's important to keep in mind when we're discussing monkeypox is remembering that when I'm working with patients, my patients and I are in a partnership for health. So my protocols and guidance added to their commitment to improving their life or their child's life, if their child is the patient, enables them to be empowered when it comes to their health. That means they learn how to heal their condition or their child's condition and bring about more health and happiness for the entire family. Also, if you are looking to purchase supplements, it's really important to make sure that they are tested for quality by independent laboratories. Please check out our online supplement store. It's the only one where all the products meet the highest standards for quality and where proceeds go to supporting treatment for children with special needs. In addition, you'll also receive 20% off the regular prices. It's at drtaketa-wong.com. That's drtaketa-wong.com. And you'll find a link in the post with this video. Now, going back to monkeypox, the crucial question is, how can monkeypox be prevented? Basically, prevention centers on avoiding contact with an infected person's skin, including during sex, and also avoiding touching objects and materials like sheets, pillowcases, towels, clothes, cups, glasses, basically anything the infected person has touched. In addition, people must take care not to touch someone's rash or scabs. Also, there are 2 vaccines available. There is one called JYNNEOS, and this is specifically protective against monkeypox. There's another one called ACAM 2000, which is authorized for smallpox and has been approved for monkeypox as well. Some antiviral medications may be available for people who are likely to get very sick, such as with compromised immune systems. Now, it is important to, if you are at risk for getting monkeypox, the CDC has prioritized people who have been in contact with people who are infected with monkeypox for getting these vaccines. There are also certain conditions where certain people should not get certain vaccines, so it's very important to talk with your doctor or healthcare provider about that. Now, what about treatment? So, according to the CDC, besides possible emergency use of tecovirimat, there are no specific treatments for monkeypox virus infections. Now, as with many diseases and conditions, making sure that the immune system is robust is the key. The naturopathic approach is to make sure that the immune system is healthy, and that starts with a health-promoting diet, meaning lots and lots of fresh fruits and vegetables. There are many nutrients in them that are known to be important. On the other side, processed meats and foods with high amounts of refined sugar inhibit the work of the immune system and should be avoided or at least reduced as much as possible. Regular sound sleep is also a vital pillar. And then finally, having optimal levels of nutrients like vitamin D and zinc are critical for the immune system to be able to function at its best. And one more thing is to think longer term. Now that means preparing for disruptions to food supply chains, storms, quarantines, and so on. I suggest putting a little bit of food and water away every month, something that is easy and affordable for your family. For this purpose, it's best to think about dehydrated foods with an extended shelf life of a year or more. And now is always a good time to start getting prepared because it never hurts to be prepared. So we've talked about today monkeypox. We've talked about the signs and symptoms of it, about how it is transmitted, how it can be prevented, and about some of the things that you can do with our current research and knowledge about how to treat it. So I trust that our discussion of monkeypox has been useful for you. Does your doctor take the time to educate you like we're doing here today? If not, you're welcome to talk with me personally about any health concerns that you may have so that you too can feel empowered with your health. To do so, just call or text our office to schedule a free phone consultation with me. There is no charge because I don't take patients without talking to them first. I always want to make sure that what we do fits your needs. You will also find all the contact information on our Facebook page. Also, if you're looking to purchase supplements, remember that they need to be third-party tested for quality by independent laboratories. Take a look at our online supplement store at drtaketa-wong.com. It is the only one where all the products meet the highest standards for quality and where proceeds go to supporting treatment for children with special needs. In addition, you'll also receive 20% off of the regular prices. It's at drtaketa-wong.com. That's drtaketa-wong.com. And you'll also find the link in the post with this video. Mahalo, thank you for joining us, and we look forward to seeing you again in 2 weeks. Aloha.